This video is for self-care tips during cold, flu, and allergy season. This should help make you feel, or your loved ones, feel a lot better and make breathing easier. Now, there are some caveats and situations where we can't do this, but we're going to talk about that at the end. Assuming that that's not a problem, this is what we're doing. This is called respiratory cupping. Now, before we get started, because it's respiratory cupping, the first question I have for you, right, is pop quiz. Do you know where your lungs are located? Oftentimes, we think that our lungs are located here, but in actuality, this is only the top third of your lungs. Your lungs actually run from here all the way down to the last rib at the bottom. So your lungs are big organs that are sitting right here, just underneath the ribs. That's why when your doctor is listening, he's got the stethoscope on your back and he's listening, right? It's because he's listening for the lung sounds, how the air is moving in and out of your lungs. And because the lungs are so close to the ribs in the back, that's the easiest and most clear way to hear it. Just didn't know that, did you? So with that said, when we do respiratory cupping, we're doing it on the surface over the lungs, which is going to be the back. Where you can, but I would not recommend doing cupping across the top of the chest on the front. And the reason is, if they're having difficulty breathing and there's issues with like, can't breathe from the top of the chest, one of two things is happening. One, they may be having an asthma attack, which we don't want to do cupping on if that's the case. The other is that they may be having anxiety-induced upper chest breathing, at which point it's a whole different animal and there's a whole different way to approach it to make the breathing easier for them. But in situations where you got a lot of sinus drainage because of allergies, or it's a cold, or you're just very phlegmy and congested, this helps a lot. So what you're going to do, you're going to make your hands into a C shape, and you're going to pretend like you're making the horse clop clop sound, like for a kid, right? And gently, you're just going to rhythmically do this across the back. It doesn't matter what direction or pattern you go in. The most important thing to understand when you're doing this is you want to stop about where that last rib is. Because right here in this space between the last rib and the hip bone on the back, this little space here, your kidneys are here. So what happens is if you're doing this over somebody's kidney, they're probably going to pee on the table. This is not what we intended to do. So stay at the bottom rib and up, okay? Now, one of the things that happens is that we often instinctively think that the more vigorous we cup, the better it should be, right? We're really shaking that phlegm up and getting it off the lungs, right? So when we don't know any better, we're like, oh yeah, bang, 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 bang. This is not what we want to do. So when we do this gently, and it doesn't seem like much to you, but it's going to feel like a lot to the person receiving it, what we're doing is we're shaking the phlegm off, right? So imagine shaking a tree branch and shaking the water after a rain off the branch, the leaves, right? Same thing. So we're shaking the phlegm off and kind of getting it to mobilize so that they can breathe, right? If we're vigorously beating them, we're going to send a lot of the muscle in the surrounding area into spasm, right? Because what happens when somebody hits you? You flinch. If somebody's hitting you repeatedly in a lot of places, all of this area is going to start flinching. It's not good. So we don't need to be hard or vigorous. Cup, C-shaped cup, like this. Now, if this is uncomfortable for you, what you can do is make the OK sign, and you can do this. Cupping is safe to do on everybody from infants to the elderly. The important thing is that you adjust your pressure and your speed, okay, for the body that you're working on. If you're working on little itty bitty babies, we really want to be gentle, right? And cupping is probably not necessary for them, because a lot of times we do a lot of this with the babies, right? The elderly, kind of the same thing. So with the elderly, you want a little bit more firm, right? A little bit more rhythmic and a little slower. Okay, one of the challenges with growing older is that we're drying up and shrinking because we're all going to turn into shrunken apple heads. So what that means is the tissue that's normally moist is a little bit more dry, a little bit more thick, a little bit more sticky. So we have to be a little slower and a lot more patient to kind of get things to loosen up and let go. Okay? So there's that. Now, the two situations that I can think of where you do not want to do respiratory cupping. One if somebody's actively having an asthma attack, this is not the time to do respiratory cupping. It will not help. It will make things worse. When a person's having an asthma attack, what's happening is the airways are literally starting to close down. They're getting swollen and irritated, and like literally choking off air. So what used to be an opening this big that air passed through, during an asthma attack, the inflammation is causing the airway to get smaller and tighter. Okay. And remember, when we're doing this, we're kind of shaking things. If they're having an active asthma attack and we're giving them cupping, we're just taking what's already an irritated airway and irritating it more. We don't want to do that. The other thing, when you're having an asthma attack, the other thing that's happening is the phlegm inside the chest and the respiratory airways, it's getting really thick and really sticky. So typically what is best is moisture, right? To try and thin out the secretions and make them more loose and watery. This is why you'll see them often with nebulizers, right? You know, where they put the thing on their face and they're breathing in with a water tank, because that nebulizer sends a fine mist of moistened air into the lungs to thin out those secretions so they're more loose and watery and they're moving down instead of hanging up here and preventing air from going down. The other thing during an asthma attack is they're typically doing a lot of upper chest breathing, right? Because the air is just not getting past here. So we don't want to make it worse. If they're having an asthma attack, we want to get them their inhaler, get them their medications, do what you normally do for an asthma attack. If they're not actively having an asthma attack, long before that happens, respiratory cupping might actually be very good for them. But again, be gentle and check with their doctor. The other time you want to be careful and you want to check with the doc is if they have some type of pulmonary disease, right? So cystic fibrosis, well, that's a separate conversation. COPD and pulmonary diseases, check with a doctor. Usually respiratory cupping is good, but again, not when they're in an acute critical breath, like really struggling. Then there's something else going on. We want to make sure they get the right professional to get in here to figure out what's happening so we can fix it. But before that, this is helpful, okay? If they have cystic fibrosis, where literally everything's it's a weird disease, but everything's kind of hardening and tightening, and there's a lot of fiber building up where it shouldn't be. Actually, they do recommend respiratory cupping because it helps move and make space in there so they can breathe a little bit easier. But again, in all cases, we're always going to be gentle and kind of take our time. So just pretend you're doing like the horsey clop clop sound for the kids, like that. Okay, and you only need a few minutes of it. So 5 minutes is good, 10 minutes is good. If you can get up for 20 minutes, like hats off to you because that's a long time. But even 5 or 10 minutes is good, and that will help shake the phlegm off the respiratory passage and make it easier for them to breathe. So give that a try. If you don't have someone to do this for you, okay, you should maybe possibly consider coming in for a massage, and we can absolutely do that along with everything else that we do to make you feel better. Okay, hope this helps. Talk to you guys later. Okay, and a couple of sidebar notes before I forget. First, they don't need to be undressed for this. They can have their clothes on, and you can literally cup it right over the shirt. Now, this assumes that they're wearing a shirt, not a big parka or a winter coat. So you kind of want to get the heavy stuff out of the way, but they can absolutely be dressed when you're doing this. They don't need to get undressed for you to cup on their back and for it to be effective. The other thing is that you can go faster, but not necessarily harder. I mean, if they're comfortable with it, you can go harder. But you're going to have to communicate with them and see what feels comfortable for them. But faster is always an option. Harder, you want to be careful with, right? Because some people, like you maybe, don't know your own strength. So you think you're being firm and you're literally like breaking ribs. So faster, not harder. And the most important thing, remember, we're talking about phlegm, right? Which is basically the equivalent of like glue. Remember Elmer's paste from kindergarten, right? So we want to make sure they're getting more fluids in their system so that they have more hydration inside to keep that phlegm thin and runny and moving, right? Because your body's constantly producing phlegm. It's like a lining that not only catches dust and debris and stuff that we're breathing in from the air, but it also lubricates the surfaces so that everything feels better, right? If you've ever had to wear like an oxygen tube, or you know somebody who has, they will tell you the biggest problem with it is that their sinuses get really dry and it's very painful. Your respiratory system, well, most parts of your body don't like being dry. So especially when we're breathing in. So that phlegm, that laying of snot, is basically lubrication to make everything comfortable and to hold some moisture against the tissue so that it feels okay to breathe and move around in your day. So more fluid. And when I say fluid, this is not, oh my God, you should be drinking more water, which you should. But remember, you can get more fluid in your system by drinking more soups, right? Especially in the cold weather, soups are ideal because that'll get the fluid in you, as well as fresh fruits and vegetables. And if you don't believe me or you don't understand how that works, I want you to consider this for a second. An apple is hard enough that you can bean somebody in the head and maybe even give them a concussion if you hit them hard enough with it. Okay. And that apple that is so hard you can give somebody a concussion is also over 50% water. Okay. So eating fresh fruits and vegetables will also get the fluids back in your system. So you're not limited to drinking endless glasses of water. And I think that's it. If you have any questions, you can send a note here. And hope you guys are going to be okay. And we'll talk to you soon.